Dear viewers, Botox is not snake venom. Let's first say what it is not rather than what it is. This is because it is frequently mislabeled as if it were snake venom. However, Botox is in fact a pharmaceutical drug. Like the common painkiller we use routinely at home, or like aspirin, any medicine we buy from the pharmacy, Botox is also a medicine. It is a drug made in a lab. Tracing its origin, it is a toxin derived from a bacterium named Clostridium botulinum, which has been prepared into a medicinal formulation state, and Botox is not poison. It is certainly not snake venom. It is a pharmaceutical product and a very effective and high quality one at that. The effect of Botox toxin is this. Specifically, by blocking hormone and receptor mechanisms, it either slows down or temporarily blocks the function of the muscles regardless of the area of the body to which we administer it. So, this is essentially described as causing paralysis, but this term isn't quite right. Botox does not paralyze. It temporarily slows down muscle function. Or we stop it temporarily. We do this consciously and intentionally. After all, this is a treatment. What are the applications for Botox? The most common reason for utilizing Botox in contemporary times is for cosmetic purposes, meaning especially expression lines. We can treat wrinkles on our forehead, between the two eyebrows, or in the crow's feet area caused by the expressions we make on our face, and even lift our eyebrows a bit using Botox treatment. The second application area for Botox is sweat treatment, especially in aesthetic plastic surgery. For patients experiencing issues with sweating in areas such as the underarms, the palms of our hands, or the soles of our feet, which is medically classified as hyperhidrosis, it is called. We can also use Botox in the treatment of sweating problems. Beyond its use in aesthetic surgery, especially for hand surgery, Botox is frequently administered for treating congenital muscle contractions in the hand. This constitutes its functional application. Primarily, I wish to discuss the aesthetic applications of Botox with you. As I previously stated, we use Botox cosmetically to diminish the wrinkles on our face, specifically in the forehead, glabella, between the eyebrows, or crow's feet regions, or to eliminate them. Since we are reducing and occasionally entirely halting the function of the facial expression muscles responsible for these wrinkles, we will subsequently temporarily get rid of these wrinkles. The efficacy period for Botox typically ranges from 4 to 8 months with an average effective duration of 6 months. While I have rarely seen effects lasting up to 1 year in my patients, I have also rarely had patients whose effects wore off in 3 months. However, please be aware that both these scenarios are quite uncommon. The standard duration of effect remains 6 months. Almost every plastic surgeon uses Botox. Almost most dermatologists use it. Sometimes even our medical aesthetic colleagues, general practitioners and physicians also apply it, and everyone has their own style and application method. It is crucial that we stress the following point here. After applying Botox, patients should absolutely not think, "Doctor, will my face freeze? Will I look like this? Will I look like a frog? Will I be unable to make expressions? Will my face freeze?" No. This is entirely related to the style, technique, and experience of the doctor who performs your treatment. Based on what I've observed from my patient group, I can say this. After the Botox treatment I administer, you will still be able to make your expressions. However, your wrinkles will not form. Consequently, this natural result will prevent anyone from noticing that you have had Botox done. Therefore, people will not realize you have had Botox. But you will receive positive feedback like, "There is a difference in you, you have no wrinkles at all, we are the same age, why don't you have wrinkles?" Usually, You will read on websites that it takes 1 week to 10 days for Botox to take effect. I want to break this memorized notion. In my own application with my own technique, you will see the effect of Botox instantly, even before you leave the office, before you leave our office. Consequently, if you have an engagement such as a wedding, a conference, or a formal invitation scheduled for this very evening, even on that same day, by getting Botox, you will be able to appear smooth and wrinkle-free. And among your friends and acquaintances, you will be able to brag in colloquial terms saying, "I am so young, I have no wrinkles." And this effect will settle in within about 1 week to 10 days on average. In terms of style, due to my inherently cautious professional style and character, I typically schedule my patients who have received Botox for a follow-up examination approximately 2 weeks afterward. Again, at the control appointment, if the patient observes any minor flaws, it is necessary to address those specific problems. If the patient sees no problem, since I am generally more meticulous than my patients if I can spot any problematic area, if there are points where we need to apply an additional dose, we will provide a solution for those points as well. And we will extend the permanence of this procedure to a longer period than 6 months if possible. In any case, for the natural look of this, I want you to know this. The same dose shouldn't be given to every patient, every area by memory. The muscles, the appropriate dose selection according to the strength of its contraction must be made, and this of course relates to experience, as you can appreciate. In any case, after this treatment you will still be able to make your expressions. However, wrinkles will not develop and you will enjoy a happy and content life free of wrinkles for approximately 6 months.